Good morning, good evening, everyone. Welcome to today's webinar hosted by Chicago GBC. My name is Chul Hyung-jeon, Director of Chicago Global Business Center. Thank you for joining us. 안녕하십니까? 중소벤처기업진흥공단 시카고 글로벌 비즈니스센터 소장
Hello.
전철형입니다.
I'm Director Chun from Chicago GBC.
안녕하십니까? 중소벤처기업진흥공단 시카고 글로벌 비즈니스센터
Hello,
소장
I'm
전철형입니다.
Director Chun Chul-hyung from Chicago GBC. Chicago is a new industrial city in the United States. It is strong in manufacturing industry. Recently, it is growing rapidly in bio industry and seen as a hub in knowledge revolution. Chicago GBC is now helping our Korean bio industry to advance into the US market. Over the past 5 years, we have built strong partnership with institutions in the United States, and we have provided various support for Korean companies. We are working with the Chicago Medical Center, Parkview Health providers, and various healthcare providers in the United States have made suggestions and feedbacks for improving our solutions. This year, we have been working with Texas Medical Center. We have signed an MOU to expand our cooperation in biohealthcare industry. Today, we will be sharing the actual know-how for starting business in the United States, specialized for biohealthcare industry. We have 4 sessions today, and for each session, we are going to be hearing from the experts who have a lot of knowledge and insight in the industry. In the first session, Senior Vice President Joe Risk from Matter will be talking about the U.S. healthcare market overview and insights. He is responsible for strategic partnership in Matter. He has been working with more than 30 companies like Pfizer and Oracle, commercializing dozens of biohealth products. The second presentation is going to be made by CEO Henry Alder. He will talk about the U.S. healthcare landscape. Mr. Henry Alder has worked in Johnson & Johnson medical healthcare strategy, and he is an expert in market entry strategies and reimbursement code. Third session is going to be led by CEO Lee Hae-sung by ACE Medical, sharing her knowledge about innovating preventive health in the United States. And ACE Medical is successfully settling down in the US market and rapidly growing every year. Last but not least, for the overseas regulations and IPR strategies, we are going to be hearing from attorneys Kim and Donald L. Zun, and they are IPR experts from a law firm. Especially Mr. Donald is an expert in patent technology and strategies for biohealthcare industry. I hope today's webinar proves to be useful in providing practical insight and knowledge for the US market for Korean companies. Thank you very much.
Thank you for joining us today. Please start your presentation.
Thank you so much, Director John. And thank you so much for having me today. I look forward to sharing some information. While we get the slides going, I just want to make a quick introduction. I'm Joe Risk. I'm the Senior Vice President of Partnerships and Corporate Innovation at Matter. I'll share a little bit about who Matter is to provide some context prior to digging into the content. But I'm really excited to be here today to share with you some of the latest trends and insights as you consider the U.S. market for expansion. So a little bit about Matter before we dive into today's content. Matter is a global innovation hub and health tech incubator that's headquartered in Chicago with a large global footprint. Our mission is really to accelerate the pace of change of healthcare, and Our core thesis upon initiating the organization 10 years ago was that partnerships amongst innovators and entrepreneurs, as well as the established industry, specifically in the United States, is the most efficient way to get new products to market. Our mission, again, is to accelerate the pace of change of healthcare. And in service of that mission, we do three core things. We incubate startups. We have collectively worked with over 1,100 startups in our 10 years since opening, again, all health tech. We've built a suite of services for entrepreneurs working in healthcare, regardless of where they're at in their journey, to help them along that journey and really to accelerate their growth. We act as a community nexus. So any given day, our team is producing content and producing webinars as well as programs that help thought leaders come together to help solve and create awareness around some of the challenges that we face specific to the U.S. healthcare ecosystem. And the last thing we do is we work with the established industry and provide corporate innovation services. And what I mean by this is we work with pharmaceutical companies, we work with health systems, we work with technology providers, we work with the insurers or payers, as we call them here in the States. We work with them to find new solutions, like some of the solutions that you are working on in your respective organizations that solve meaningful problems. So in service of our mission, those are the three things we do. If you go to the next slide, I'll share a little bit about kind of the journey and where we've been. So as you can see, I mentioned we've worked with over 1,000 startups from across the globe. I think the interesting highlights here is we are structured as a nonprofit entity. One of the things that we're very proud of is over the last 10 years, we've collectively helped our startups raise $5.3 billion in capital. And again, I mentioned, the primary focus of today's conversation will be the U.S. landscape in digital health. Digital health is where the majority of our startups play. That said, we also have startups that are working in other realms like life sciences, services, et cetera. The last thing I'll note is the partner sections right here. We've built this large ecosystem of over 140 established entities. And I think this is a very important and an extreme differentiator. As you think about entering the U.S. market, what are those partnerships and what are those integration points that you need to be considerate of? How do health systems work with pharmaceutical companies? What initiatives are they working on together, as an example? Health systems are stretched thin right now. What are the solutions that they need the most? So it really creates an ecosystem in the United States, which we'll talk about here shortly, to really make change, and that's our core thesis. With that said, the last thing I'd like to highlight is you probably saw COSME on that slide. We're on our 5th year of a partnership with COSME, specifically the Chicago office. I'd like to thank Director June again, as well as Molly Park, for their continued leadership. And I'm really excited about this year's program, where we'll be working with Korean startups and SMEs to really help early validate their products here in the States. So looking forward to another great year of that program. And I'll talk a little bit about some of the key drivers as to why that program has been going for 5 years. So we'll talk a little bit about the trends that we're seeing here in the States, as well as some insights as you consider your go-to-market here in the US. Next slide. I think one of the most compelling slides to share today is really just this slide. This is really the opportunity as you see it. The US has the most expensive healthcare system in the world. You can see that last year we exceeded $5.3 trillion in US healthcare expenditure, and that number is predicted to go up another 8% next year. And really looking at it per capita or per individual in the United States, roughly $16,500 out of pocket a year. Comparing that to South Korea, you're at about a third of that. So we spend a lot of money on our healthcare, and it's going to continue to go up. And really the factors that are contributing to these high costs include higher costs for services, administrative costs, and greater use of expensive technologies that we're using today. And the sad thing is, despite the high spending in the States, we do not have the best health outcomes compared to other wealthy nations. If you look at things like maternal mortality, our outcomes are very, very poor. So we have a lot of work to do, which I think is the opportunity that all of you have when entering the US market, is to truly understand that it's a broken system, which means there's plenty of opportunity, and there's a lot of different ways that we can make change. Next slide, please. I think it's important to really consider some of the macro trends that we're facing in the United States, and this is really driving the cost up. I think everybody's familiar with the aging population. We're living longer. we have more chronic diseases that we're managing, which is very expensive on the system. In addition, when you look at the aging population, we have a shortage of caregivers. We have people that are living longer that can't necessarily take care of themselves. So it's creating a lot of strain, not only on consumers and caregivers and loved ones, but there's just a significant shortage. So that aging population is a macro trend that's impacting our healthcare. Cost pressures from all factors of healthcare will continue to drive change. Policy changes, we're looking at AI. AI is the buzzword. We're implementing AI. What are the policies that need to change to basically make this happen? We went through an administration change this year. The way that federal dollars are deployed in healthcare have shifted drastically. And also consumerization. Individuals here in the States are taking more of a proactive role in their healthcare. And they're looking for options or looking for solutions proactively. So all of these are macro trends that are ultimately impacting healthcare. If you could go to the next slide, please. This is a very interesting slide. The investment dollars, specifically in digital health, we know in 2021 they were at an all-time high. And since then, we've been gradually declining, although funding remains steady. Digital health startups raised $6.4 billion, as you can see on the far right, in the first half of 2025. So just a modest increase from the year before into 2023. And digital health startups raked in more venture capital funding in the first half of the year, signaling the market stabilizing. And I think what's interesting about this half of the year, Q1 2025, that roughly $6.4 billion is 62% of this is AI solutions. So AI continues to be a hot topic, which I think sets up the Korean startups for just wonderful success here in the States. We've had the pleasure, as I mentioned, of working with the COSME office in Chicago for 5 years, and we've seen firsthand some of that game-changing AI technology. In fact, you'll hear from Dr. Haesung Lee, the founder and CEO of Airs Medical today, and they're just a tremendous case study, and I think what good looks like when entering the U.S. market. They've had a tremendous amount of success in a very short amount of time, which is very compelling. So I think knowing where the spend is going in AI just makes it an unbelievable opportunity for you. Drawing on those trends a little bit more, where are those dollars deployed? I mentioned artificial intelligence makes up the biggest chunk. Health management solutions, which includes EHR systems or electronic health platforms, hospital operations and optimization and tools. They're the second largest at about $2 billion. Our U.S. health systems are strained. Physicians are overworked. Everybody's feeling the pinch. So everybody's looking for tools that can maximize revenue and take the burden, or take less of a burden on the workers. And the last thing I'll mention here is, some disease states specifically that really stand out. Oncology is by far the largest spend, very complex care here in the States for oncology care, and a significant need to break down silos and share information, specifically, in healthcare, or excuse me, in oncology. So, we're seeing a significant shift in solutions that are coming from other disease states that are applying the lens to oncology. And then mental health, since the pandemic, is an area with continued growth that we'll continue to see growing over the next several years. On top of that, we have a tremendous amount of data here in the States in healthcare. Next slide, please. And that data really leaves an incredible opportunity for entrepreneurs and innovators like yourself. In 2015, the majority of health systems have adopted electronic medical records. It was widespread, a massive increase in patient data coming into the systems. But the evolution is not done. What's interesting is, as of last year, only about 90% of the data that's coming to the EMR is being used. So there's a significant landmine of data that needs to be mined to basically make our systems more efficient and to make the health systems more efficient. Just a couple of use cases of the ways that we're seeing this work is, specifically in oncology care, seeing people mine data to basically identify patients in a clinical trial in real time. The traditional way of doing this was very manual, using spreadsheets and relying on people to basically flag things in systems. And now we can automate that, which is leading to significant revenue for the health systems, but also the pharmaceutical companies. Next slide, please. And 30% of as I mentioned, 30% of all data is coming from healthcare, which is the largest of all sectors, which is really interesting. And again, this just reinforces the opportunity that we have in mining this data and how all these pieces fit together. So on top of that, we have an evolving business model. You've heard the terms value-based care. If you go to the next slide, please. The definition of value-based care, for those of you that don't know, is really changing the way that we deliver care to hold providers, hospital labs, doctors, nurses, people providing care, to basically provide outcomes for the services that they're rendering. So it's really about the quality of the care that people are receiving. So this transition has really caused entities to look differently at the overall consumer and patient experience. So you'll hear patient centricity, patient journey used a lot in the U.S. And it's a model that's going to continue to keep growing. They estimate by 2027, 90 million lives will be under a value-based care model. So again, as you're looking to commercialize here in the States, it's very important that you understand how the dollars flow and how people are incentivized to treat. So with all of this said, with all of this data, with all of this AI, with all of this unmined opportunity, where can this technology take us? What are the opportunities that you have as you enter the U.S. market? And where it's going to take us is really, moving from episodic care, so I feel sick, I'm going to go see a doctor, to really receiving care anytime, anywhere. Really breaking down those silos, using technology to allow people in rural environments to access top providers is really where we need to go and where we need to head. And the technology exists. It's just a matter of time before we get there. In addition, we're going to move to a model that's less reactive. So when I get sick, I got to go see a doctor, to basically getting indications and signals through sensors, through technologies, through wearables that allows me to receive care that's predictive, proactive, and personalized. So again, all these tools exist to do this today. It's just really understanding how these systems work together and really understanding that innovation can make the change here in the States to really make this kind of accelerated with adoption. So key considerations as you're looking to move into the U.S. markets. And again, this is built off of our experience in incubating over 1,000 startups, as well as working specifically on the COSME program over the last 5 years. And it's very complex. And you'll see from the slide, the next slide, that healthcare in the U.S. is just very challenging. And this is why. It usually starts with the individual. The individual, goes to seek care from a healthcare provider. This could be a doctor, a hospital, or another healthcare setting. The healthcare provider then performs goods or services. They leverage CPT coding, which is basically a process for coding medical services that streamlines the reporting and reimbursement and accuracy. You'll learn more about that from Henry in a presentation shorter. If the person is older adult, over 65, or has limited income, they might qualify for government coverage, Medicare, Medicaid, which you can see, which will pay for a portion of the coverage. However, the majority of people get their insurance through their workplace. And the workplace basically provides a health insurance. The individual may or may not pay premium based on what the insurance covers, as well as the individual employer. When the individual requires service, they may pay a portion of that service called a copay. Again, this is relying on what services you have, what insurance coverage you have. An upfront payment for their policy, a deductible to the service provider, could be performed after services are rendered. In addition, the insurance company pays a portion of the claim. So you can see it's very complicated, and that's why here in the States there's a large opportunity for innovative startups coming from Korea to really make change. So again, it's important that you understand how the dollars flow when you're creating your solution. It cannot be an afterthought. It has to be something that you come to market with well planned. Next slide. And this just breaks it down a little bit further. As I mentioned, the majority of people here in the States get their insurance from their employer. About 92% of all Americans, 305 million, have insurance coverage. So you can see these other coverages. You got some military, you've got a small percentage that's uninsured. You got individuals that purchase direct. So there's not a uniform way. And I think it's, again, important for you to know that healthcare here in the States is not clear cut. It's very, very complicated. Next slide. In addition, it's highly regulated. We all have heard of the FDA, right? We all heard of regulations, 510K clearances, PMA. All of these things cannot be an afterthought. You must think through your strategy because this is the first question you're going to get from a potential partner, a potential client here in the States, or an investor is, where are you at with your regulatory pathways? And what is the roadmap? And how much is it going to cost? So these cannot be afterthoughts. These have to be something that's thought through prior to coming to the United States for your go-to-market. Next slide. And again, compliance. There are a ton of restrictions, highly regulated industries. We've got HIPAA, which is the Health Insurance Portability and Accountability Act that most of you are familiar with. We have the Sunshine Act, which is more related to pharmaceutical companies and their interactions with physicians. That basically, posts on a public website what physicians are getting paid by what company for the work that they're doing. So there's just a lot of data interoperability standards that you need to be conscious of because ultimately the United States and the health systems here aren't going to change the workflows for your solution. Your solution must plug into existing workflows and ultimately be simple for them to deploy. So I know I just said a lot. This deck will be shared with you all as follow-up. But there are some key takeaways and some best practices that we've seen over the last 5 years. And I'll summarize some of those best practices. Number one is you need clinical evidence. The US is extremely data-driven when they make purchasing decisions. Your solution working well in Korea is great, but it isn't enough. It is a good proof point, but they're going to ask for more. So, it's important that you find avenues and ways to conduct small validation or pilots with entities here in the States. And there's several platforms that you can do that with. Like the COSME platform, we run several accelerators a year that focus on this validation in ex-US companies. The second is your business model must fit the US payment system. 53% of all digital health solutions deployed in the States are primarily sold into health systems, or the provider is the main contact there. So it's important that you really understand the journey. And again, you're adapting your technology to the infrastructure that exists. They're not going to make changes for you. In addition, FDA approval does not guarantee market success. There are several technologies that have clearance and just don't necessarily fit the bill. You need to show a clear path to revenue. And then I think the third thing is cultural adaptation. And this goes just beyond language and translation. We have different workflows here, right? Different decision-making processes. We've got IT departments that are backlogged. We have different regulatory concerns. So you need to really know and have local expertise, either by hiring someone locally or leveraging kind of a fractional service to really understand your best approach when it comes to implementing here in the States. And then the last thing I'll mention is you got to be patient. The average sales cycle of a health system here in the States is 12 to 18 months. So you should be talking to several people at a time and hoping that they stack and one hits, upon another. But you just have to be patient and be persistent. And then the last thing I'll mention is when it comes to the current environment for raising capital, integration is important, ROI is important, revenue is important. It's shifted drastically. They're looking for more mature companies. So it's very important that you have clinical validation and either a path to revenue or existing revenue in Korea to show people that there is a clear path for revenue in the States. So with all of that said, I'll be staying on for QA here shortly, but remember the best time to enter the US market is when you're prepared. You can't rush things. So make sure that you're checking all of those things that we just talked about as you plan your approach here in the States. So with that said, I will stop sharing my screen now and we'll turn it over for some Q&A. All right, looks like we have our first question in the chat, and I will read it aloud. Oh, interesting. Our company is currently developing a device that collects and measures driver health information from the car's seatbelt and steering wheel. We would like to hear your insights on customer interest in the vehicle IoT healthcare devices that measure driver health information in the U.S. automotive aftermarkets, as well as strategies for entering this market. For reference, health metrics measured include heart rate, oxygen saturation, stress index, and heart rate variability. This is very interesting and something that I actually worked on back in 2012 with some of the cell providers, Verizon and AT&T, when they were really looking at the connected car and the IoT of things. Healthcare was on the roadmap then, and it is still on the roadmap. So I'll answer this question in a couple of ways. I think number one, there is a significant appetite for that. It's IoT in cars here in the States is expanding rapidly, driven really by consumer interest for real-time monitoring, et cetera. The category itself is growing 8% a year. And so there is a shift there. And in North America, specifically United States, represents about a third of all the spend for automotive IoT. Driving monitoring systems that track health metrics, as you mentioned, are being looked at by the OEMs, original equipment manufacturers, as well as the payers, I know. And there is a strong consumer interest. In fact, if you look at entities like AARP and their Age Tech Collaborative, there are several automotive companies that are part of that collaborative that are really looking at this very subject. How do we keep people in their cars more educated on their overall health? As an example, one of the examples I heard was if you're sitting in traffic and you have a sensor on your steering wheel and it notices not only that there's a high traffic area, but your heart rate increases, maybe it could turn the air conditioning on automatically and then play classical music in the background to slowly bring your heart rate down. So it's very interesting how these sensors and these materials could, in fact, play within healthcare in the car. So I will continue to answer this question a little bit about some of the strategies that I've seen work well. I think the focus on aftermarket of existing vehicles is probably the best target. And it sounds like this technology is just that. Because I think the aftermarket model is probably better. Consumers here in the States aren't buying new cars right now. Interest rates are increasing, the tariffs, et cetera. So things need to adapt to existing infrastructure. The products need to be aligned with U.S. regulations. There's an organization, NHTSA. I don't recall what it stands for, but they make the regulations for this type of things in the cars. Car dealerships also and fleet operators. If you think of large fleet operators that are deploying several thousands of cars, think of pharmaceutical companies that have thousands of sales reps here in the States. They're looking for bulk installation and service packages where they can track these types of metrics. I think validation is going to be very important as you enter this market and differentiation. And then if you have pilots, I think pilots are very important as well. So I would say in summary, the market favors integrated solutions, combining kind of hardware, software, and real time. The rising standards for vehicle safety and insurance contribute to the adoption of driver health and monitoring. So there's incentives that will be deployed, I think. Data privacy and cybersecurity are always going to be concerns. So we need to make sure that we proactively address them. And then you need to compete by showing tangible safety and health financial benefits to fleet managed vehicles or individual drivers. So there's a significant opportunity. I would look again at the AARP Age Tech Collaborative as an entry point. They run global accelerators every year that look at these topics, and they bring those Age Tech Collaboratives or those other large companies in to view these. And I know this is an area of interest for them right now. I've heard. In addition, direct to the OEMs. So think of the Verizons, think of the U.S. Cellulars, think of the AT&Ts that are powering this connected entity. There are entities like the Verizon 5G Connectivity Lab in conjunction with Emory University's medical school in Atlanta that study technologies like this, which could be a great place for a validation study. So I think it's a tremendous opportunity. I think, in theory, they wanted to do this years ago, but it's just taken a long time to come to fruition. But I know and I'm actively in conversations around this very topic. So let me know how I can be of help as you continue your journey. Let's see, additional questions. Oh, we got another question. So the question is, as a company entering the U.S. market for the first time, what is the optimal route to get your product placed in CVS and or Walgreens? So not knowing the product, I have had success in my life selling into retail situations and healthcare for both CVS and Walgreens, and we have relationships with both of those entities. So we've seen firsthand their appetite for meeting with new technology. So the good thing is they do this all the time, and there's several opportunities and avenues to deploy to get there. And I would say, getting into CVS or Walgreens is not a first step. They're very sophisticated buyers. So you need to show traction, compliance. You need to show that there's demand. If there's a competitor in the space, you need to really show the differentiation, because if it is a retail play, their shelf space is very, very important to them. And it's very, very competitive. So the optimal route is to build proof points through smaller channels, secure distributor partnerships, and then you can scale into the majority pharmacy chains. There are ways that you can get into CVS and Walgreens. There's a platform that we leveraged back in my previous company called RangeMe for product submissions, which is basically a website that you can submit product requests on, and they'll view them. And if there's interest, the buyers will get a hold of you for a presentation. If it's a healthcare opportunity, there are innovation teams and venture teams within CVS and Walgreens that are out scouring and scouting, and we have relationships with them. So they'll give us their points in which they want to explore, and we'll simply send them companies that they meet with that basically help. And if they are interested, then they'll do either a small pilot or they'll bring you into the organization for much larger discussions. I would say you need to be persistent. These are very long and very, very competitive sales cycles. So you need to follow up with the retail buyers after the initial submission, build the relationship, adapt your pitch based on the feedback. The buyers are very, very good at giving feedback and letting you know how to shape your solution to the best of what their needs are. And then there's also seasonality incentives that you can look at. If there are health trends, cold, flu, allergy season, again, I don't know the product here. Those are also great times to reach out to the buyers or the distributors to say, hey, it's flu season's coming up. As an example, here's a solution that's going to help patients as they go into flu season. So you need to build your U.S. presence, develop a strong U.S. facing website, social media presence, demonstrate U.S. consumer engagement and brand seriousness, and ultimately you'll get the meeting. So again, in summary, you need to show clinical validation. If it's healthcare, you have retail channels as well as innovation and healthcare channels within these organizations. And so whatever your technology does, you just need to find the right channel for them. And then obviously prepare a strong case that's going to be compelling. Excellent. Great. So we're just going to pause here for a second to see if any other questions come in. And that looks like it concludes my section. Again, thank you so much for the opportunity to present today. I wish you all the best of luck on your journey as you look to expand in the U.S. markets. And remember, matter.health is a resource for you as you look to expand here in the States. Have a great morning.
Well, good morning. This is Henry Alder. Just wanted to confirm everyone can hear. And I see my audio seems to be working. And I see I've got in the chat room that I can proceed with my presentation. Thank you very much. First of all, I'd like to thank Director Jung, Molly Park, and Aaron Wu for the opportunity to present to you today. My presentation is going to be looking at CPT coding that Joe briefly mentioned in his presentation just a few moments ago. Next slide, please. This slide is basically, if you will, the legal document in my file for my presentation. It's a disclaimer. The reason I include that is because the information I'll be providing to you sometimes can have a legal component to it. And in this case, I just wanted to ensure with you that the information I'm providing is coming from a number of different sources, including the American Medical Association, the World Health Organization, as well as from the Medicare program, Medicare and Medicaid Services Program. Next slide. So what I wanted to share with you is why you should know about CPT codes. And the reason is pretty straightforward and actually rather simple. And that is when providers, hospitals, physicians, and other healthcare service providers are purchasing a new medical technology or a medical device, the first question they're going to know is there going to be a reimbursement for it? And specifically, is there a CPT code for the product and or the procedure that they can bill when using your product in a setting, such as a physician's office, in a hospital, in an outpatient area, such as an emergency room. And that's what I'm going to be talking to you about over the next several minutes. Next slide. So CPT codes. CPT is the abbreviation for current procedure terminology. CPT codes basically describe every single medical procedure and services that's available to patients from physicians, from hospitals, and from other clinical providers. Physicians and other providers basically use the CPT code to bill healthcare insurers for the medical services that they provide. Joe talked about that a little bit in his prior presentation. There are a lot of CPT codes out there. In fact, there's this volume that's produced every year by the American Medical Association listing all the CPT codes. And as of last year, there are more than 11,000 CPT codes for the various medical procedures, medical services that can be provided by providers to patients. Next slide. Medical surgical procedures that are enabled by a medical device generally must have a CPT code. So if you're going to be introducing a new medical product, one of the things you want to look at is there a CPT code that describes either the medical product or the procedure that the medical product I'm going to provide is enabled. In other words, is there a procedure that physicians can get paid? So in other words, if you're going to be coming up with a new procedure based on your technology, it's going to be important that you think about acquiring a new CPT code. And CPT codes would be acquired directly from the American Medical Association. The American Medical Association, which is based here in the Chicago area, is an organization that's responsible for maintaining CPT codes. When I say maintaining codes, they're essentially updating the CPT codes, either adding a new numerical designation, or they're redefining the code using a new different nomenclature or different descriptions. These CPT codes are updated every year annually. Next slide. There are basically two types of CPT codes. They're called Category 1 codes and Category 3 codes. A Category 1 code is a standard CPT code for the medical services and procedures that physicians provide, as well as other healthcare professionals, and including some specialists in specialty areas. These are what I call permanent CPT codes that physicians and other healthcare providers will use on an ongoing, if you will, a daily basis. In some occasions, the AMA will designate certain new procedures or technologies as Category 3 CPT codes. And these are temporary codes for new technologies, emerging technologies, or medical services and new medical procedures. So in other words, if you're going to be coming up with a product, with a procedure that isn't listed as a Category 1 CPT code, it would probably be important to think about how can we go about getting a Category 3 CPT code. Next slide. Category 1 codes, if you need to apply for that, can be very difficult to obtain. You obtain the code by submitting an application to the American Medical Association for a Category 1 CPT code. Here's a listing of the requirements to obtain a CPT code Category 1. First of all, your product or device is going to need FDA approval. And Joe talked about the FDA previously in his discussion. You're also going to need one or more peer-reviewed clinical studies that have appeared in a Tier 1 or Tier 2 medical journal. Ideally, one of these articles needs to be published in a journal that's distributed and published here in the United States. You'll also need some strong support from medical specialty societies and medical specialty groups. And you're going to have to demonstrate there's widespread clinical use of your medical technology. Next slide. If for your technology does not meet the requirements for a Category 1 CPT code, you can always apply for a Category 3 CPT code. Category CPT codes, again, are temporary codes for emerging technologies, emerging services, and new procedures. What's important about the Category 3 codes is that these codes can be used once they've been approved by the AMA on billing forms to insurers. These Category 3 codes allow the insurers to collect information, new data, about the procedure, in other words, for what patients is it being utilized on, what are the outcomes of these patients, and so forth. The downside of a Category 3 code is that some insurers may not pay for Category 3 services. Next slide. So once you obtain a CPT code, they do not necessarily guarantee coverage or payment from an insurer. Commercial payers and government payers in the US, Medicare, Medicaid, the Blues, and others, have very rigorous processes to evaluate new medical technologies for coverage. So it's another consideration or concern you'll have coming into the United States. While you may have a CPT code for either Category 1, Category 3, that does not necessarily mean that a payer, such as the commercial plans or the government plans, are going to cover your procedure. The other issue is that coverage policies can vary from one payer to another payer, and even within a payer, they can vary from one plan to another plan within that payer organization. You may want to think about a plan as an individual group plan that an employer might make available to their employees. So for example, a employer might obtain a plan from a Blue Cross plan or from an Aetna here in the United States, but another employer would write a different plan with a commercial payer, such as an Aetna or Blues or Cigna. So one of the things to remember or keep in mind is that obtaining a positive coverage decision can take a long time. I had weeks, months, years. I'll let you know it sometimes takes more than a few weeks. It's usually months or sometimes years, unfortunately. So something to keep in mind as you introduce your technology is that while you may obtain a Category 1 or Category 3 CPT code, encouraging the payers and convincing the payers to cover your technology can be very time-consuming and would delay your, if you will, widespread use of your technology in the United States. Next slide, please. So in other words, coverage can become a very high hurdle for your technology if you're a startup, especially when you're introducing a new technology that doesn't have any experience in the United States, or it's a disruptive technology. In other words, it's disrupting some of the current technologies or current procedures that are now available in the United States. One of the other challenges is that commercial payers, as well as government payers, are not always up to date or aware of new technologies, new procedures that are coming about. So as a result, a key recommendation that I want to leave with you, start thinking about your CPT coding strategy, as well as your coverage strategy early on in your medical technology development journey. Next slide. Let's talk about some other reimbursement codes that are utilized in the United States. They can be just as important as the CPT codes that I described to you a few moments ago. Next slide. There's something called HCPCS codes. They're called specifically Health HCPCS Level 2 codes. HCPCS means Healthcare Common Procedure Coding System. And HCPCS Level 2 is a collection of codes that represent procedures as well as like CPT codes, but they are more focused on supplies and products and non-physician services that are generally not included in the CPT code listing. Physicians, non-physicians, such as nursing staff, hospitals, laboratories, as well as outpatient facilities such as physical therapy may be using HCPCS codes. Very much like CPT codes, there are a large number of HCPCS codes now in use in the United States. There are actually over 7,000 of them as of the beginning of this year. Next slide. The other group of codes that are used are called ICD-10 CM codes. They're used to code for specific diseases and patient medical conditions. Healthcare facilities, hospitals, as well as ambulatory facilities use ICD-10 codes when they're diagnosing a patient. And ICD-10 codes is based on the ICD-10, which is International Classification of Disease. International system uses a code used for coding and classifying both morbidity as well as mortality data. Next slide. I'll take this opportunity to say thank you very much for listening to me in this presentation, and I'd like to open up now for some questions. Going down to the chat. First question is, what type of contract is most effective? Covering essentially the entire US market, or looking at it on a state-by-state basis? Well, when I think about contracts, I'm thinking about who do you want to contract with. In the United States, there's an opportunity to contract with individual physicians and individual providers for your technology. If you're thinking about just wanting to start it and investigate it through a clinical trial, or some kind of evidence generation or evidence collection. The other opportunity is a contract with a medical device company. And a medical device company might be willing to work together with you on a contractual basis to determine how that technology might fit within their portfolio of products or services that they're offering. And finally, there's an opportunity to, if you will, work with regional providers. Could be a hospital system. It could be, again, an individual physician who might be interested in contracting with you, again, to begin looking at some pilot studies. In this stage, you would not be selling your product, but rather collecting some very important evidence and clinical data to demonstrate the efficiency and effectiveness of your product. And then with the possibility of then taking the data or evidence you've collected and submitting a paper to a medical journal, whereby you would be able to, at the medical journal, getting it published, for distribution to individuals, particularly in the clinical area that you are interested in providing a technology or a new service toward. Question 2, I would like to learn about software regulations and certification requirements in the US healthcare market. Well, that's a large question, and there's probably a number of different things or different ways to think about answering it. The first is software regulations and certification in the US healthcare market is quite broad. As you've learned, if you haven't, as you started listening to me, as well as to the previous presenter, Joe, the US healthcare market is very heavily regulated, especially when it comes to software that impacts patient safety and patient well-being. The key regulatory bodies in the United States are essentially the Food and Drug Administration. The FDA is a primary agency that regulates medical devices, including some healthcare software. Software as a medical device is usually software that is intended for medical purposes without being part of a hardware medical device. And FDA provides oversight in this area in an attempt to look at the risk of the software. And in other words, they will look at whether it's a low-risk software. In other words, it would be classified as a Class 1 device, or is it going to require some very rigorous pre-market approval under a high-risk or Class 3 product. The key requirement for software as a medical device includes a clinical evaluation, ensuring that there is a quality management system in place. And a quality management system includes a structured framework that outlines the policies and procedures and processes that have been put in place to ensure the safety and effectiveness, as well as the quality of the medical device utilizing this particular software. There are also other organizations that are involved in evaluating the software in a medical product. One is called the Office of the National Coordinator for Health Information Technology, and they're the ones who promote health IT adoption and use, including health IT certification. And then finally, there's interoperability and information blocking. The ONC is involved in this in implementing 21st Century Cures Act, which basically provides provisions on electronic healthcare information exchange and information blocking. Any other questions? Let me read it to you. Our product is a gait analyzer, walking analysis device designed for the diagnosis of sarcopenia, I hope I'm pronouncing that correctly, and other mobility-related diseases. We are primarily a software-focused company, and our solution is classified as CDSS, Clinical Decision Support Software. We would like to know whether CPT code application would be possible for our product. We understand that CPT codes 96000 and 96004 are applicable for gait and motion analysis, and we would like to confirm whether our video-based CDSS gait analysis solution could also be reimbursed under these codes. My recommendation to you is to possibly get a hold and contact the American Medical Association. And this is the type of questions that they are able to, if you will, address for you on a direct basis. The AMA, it can be queried through their website. And this would be one of the questions that what is called their CPT editorial group would be able to answer for them. Another party you might want to go to is work with a independent consultant who can do that analysis for you if you're reluctant to contact the AMA themselves. And this particular consultant can determine the specific definitions and descriptions of these CPT codes and determine for you whether the CPT codes seem to fit with the technology that you're providing or that you're going to be offering. Are there any other questions? Here we go. Let me read it back to you. If a CPT code has not yet been assigned, is there another coding system to officially validate evidence that a solution enhances CPT code coverage services? Could HCPCS serve that role? Well, if a CPT code hasn't been assigned, and that's some research you want to do, has there been a either a CPT level 1 code? If a CPT level 1 code hasn't been assigned, let me correct myself. Perhaps there's been a CPT category 3 code or level 3 code assigned. That would require some research on the AMA website of the CPT codes to determine if there's a CPT code that would be comparable to your technology. The HCPCS codes now are more inclined to be useful for you if you're offering a specific product. There are a number of HCPCS codes that have been developed for individual products, and that might be an opportunity for you if that's the direction you wish to go for your technology. Again, doing some research as to what HCPCS codes and as well as CPT codes are currently available, and if these codes are similar to your technology, it might be worthwhile doing some research whether indeed the current HCPCS codes as well as perhaps current CPT level 3 codes might indeed be useful for your technology. And if you will, then make your life a little bit easier as you bring your technology to the market. Live question number 3. In expanding into the U.S. market, would it be advisable to have the U.S. distributor manage CPT coding and negotiations with insurance companies? And then the second part was regarding the requirements for CPT code level 1. Must peer-reviewed clinical study be conducted within the United States? Let me answer question number 2 first of all. Ideally, the research must be done in the United States, but I think it's sometimes more important to have the research done and then published in a US-based peer-reviewed journal. Now, I can't always rely on that because individuals who make the decisions on CPT code level 1 are individuals who tend sometimes to be a little bit on the political side. On the
Recording
CPT
in
code
progress.
To see indeed if that's something that they would be willing to do for you. Again, it's a time-consuming process, as I mentioned a few moments ago, but it's something that you might want to consider, if you will, making it easier for you as you enter the marketplace, looking to the distributor to assist you in that process. I don't see any other questions. Well, I did get another question. Let me read this to you. Why are CPT code and HCPCS codes separated? Which would be more advantageous for a product? And the second part of the question is, during the CPT process, what is the best way to persuade U.S. payers to support reimbursement? Well, let me answer the first question, why CPT codes are separated HCPCS codes. CPT codes are run by the American Medical Association. HCPCS codes are evaluated by the Center for Medicare and Medicaid Services, and they include CPT codes. So it would be advantageous to try to obtain a CPT code if that's a possibility. But as I mentioned, that can take a number of, it can take a substantial period of time, can take a number of months as well as a number of years. Whereas HCPCS codes might be more advantageous to us, especially if your product is a product that's utilized in, let's say, a physical therapy setting, or in a lab setting, or in a setting that would be in an individual physician's office. During the CPT process, what is the best way to persuade U.S. payers to support reimbursement? The best way to persuade U.S. payers to support reimbursement is to bring clinical evidence, clinical data to them giving them an opportunity to review it themselves, to determine if your technology is something they would be willing to cover and to pay for. I guess there are no more live questions. So thank you very much for the opportunity to share my thoughts with you on CPT and encoding, and I wish you all the best of luck. Take care.
네, 안녕하세요. 다음은 이제 해외 진출 노하우에 대해서 한번 말씀을 나누게 될 에어스메디컬 대표이사 이성이라고 합니다. 모든 헬스케어 기업이 다 조금씩 다를 수 있기 때문에 이제 저희 경험을 어떻게 일반화시켜서 이러면 된다로 받아들이실 필요는 전혀 없을 것 같고,
My experience.
그렇더라도 저희가 한 게
And
이제
even if
어떤
that
일을
is the case, I still believe it is meaningful to share our company's experience with you today.
2023년 11월에
In November 2023, we began working with Chicago GBC Center to enter the American market. And until the end of 2023, we had less than 5 American customers, but we have 350 customers in the US and more than 1,000 customers around the world. As for our major KPIs, we look at software subscription, ARR, and based on ARR, as of January 1st, 2024, we have grown to 11 million. It was 11 million, but it has gone up tremendously to 20.3 million this year. And we are shortening the time for MRI imaging. It used to take 30 minutes for standard MRI. Technicians, when they change the parameters, they can shorten the MRI imaging, but that could lower the resolution or increase the defect. So a compromise in quality can be found, but AI can correct that. And by enhancing the parameter acceleration modification, we also provide cloud-based acceleration. And you have to satisfy various requirements and regulations in the United States. And each company has different IT security guidelines. You have to look at HIPAA, Cyber Essential, SOC 2. These are the regulations that we need to comply with. But we provide all of our services through cloud. We have AI software solution for MRI equipment, and it resides between MRI and PACS server. And after imaging is taken, that image can be sent to PACS directly just by clicking a button, and Swift MRI will take place, and then it will be used for diagnostics. The hospital's technicians or radiologists, they need less than 10 minutes of training. All they have to do is what to do when error happens. And as for our adoption, we looked into various ways to increase adoption. And if we can shorten MRI imaging, you can take more pictures in the same period of time. In hospitals or imaging centers in the United States, you have to wait 3-4 weeks to get your image taking, meaning that you can treat 33% more patients per day, and that could increase your revenue greatly. So with the additional revenue, you can pay our fixed
뭐 4,000불 정도
subscription,
평균 정도
which
하고
is
있는데
like an
사실
average
이게
subscription
서비스가
fee of
굉장히 다양한 형태로
$4,000 per
납품할 수
month.
있는 사람이 또
We
어떻게
can
이제
provide
장르를
our
보느냐의 모델에
services in
따라서
a
비용이
very
충분히 다르기
flexible
때문에 완전히
manner,
에버리지
and the
수밖에 없다라는 점
subscription fee
말씀드리고요.
differs, but this is the
지금
average
와서는
number.
저희가 뭐 어떻게 디스트리뷰션을 해야 되는지도 꽤나 그
And
플레이북이
for
세워져
our
있습니다. 그래서
distribution,
이제
we have a very
이미징센터, 특히
flexible
인디펜던트
solution
이미징센터
for
같은 경우에는
independent
저희가
imaging
아무래도 최대한
centers.
늘리기 위해서 뭐 채널
We
파트너들과 함께하고 있고요.
also
채널
work with
파트너
channel
중에서는 뭐 AI
partners,
플랫폼 업체도
and
있고
some of
뭐
them
MRI
are
서비스
AI
프로바이더, 뭐
platform
MRI 장비
providers,
프로바이더,
MRI
뭐
equipment
다양한
providers,
그
service
후보분들과
providers. So
디스트리뷰터들과
we
함께하고 있습니다.
work with
그리고
various
이제 아주 큰
distributors and
병원들, 아카데믹
partners.
허스피tal
And
또는
for
라지
academic
이미징 센터 네트워크
hospitals who are
같은 경우에는
large
저희
imaging
본사에서
center
직접
networks,
개입을 해서
the
IT, 뭐
headquarters
세큐리티,
gets
뭐 매니지먼트
involved,
니드 또는
IT,
신제품에 대한
security,
부분들까지 저희가
management
직접 목소리를
needs.
들으면서
So we
이렇게
hear
하고
their
있습니다.
feedback directly.
그래서 뭐 지금은 뭐 잘 되고 있는 얘기들에 대한 어떤 말씀이었을 수도 있는데 이거를 저희가
So
처음
looking
미국에
back,
왔을
when
때
we first entered the
2020년
American
그때
market
도대체 우리가
in
어떤 생각들을 하면서
2020,
어떻게 비즈니스를
I looked
했었지에 대한
back on
고민들을
what
좀 많이
kind of
해봤어요. 근데
mindset and
저희가
approach we
했던
had for the
가장
US
그
market.
고트마켓에서
Our
제일 중요했던
first
전략은
step
일단 로우 행잉
in the
프루트부터
American
어떻게
market
타겟한다였던
was
거였습니다.
to target the
이게
low-hanging fruits first.
한국에서 온 이제 스타트업이라고 했을 때
We
한국에서
are
기업이
a
얼마나
startup
성공했다라고
from
사실
Korea.
미국에서는 거의
So
알려져
even
있지
though
않는
we are
부분들이
successful in
있잖아요.
Korea, there's a
그랬을
high
때
probability
처음부터
that
미국 본사에 있는
no one
VC들을
in the
타겟을
US
하기에는
knows your
사실
company.
협상력도 할 수가
So
없고요. 그리고 그
we
자리에
did
인터랙
not have
충분히
any
만들어주시는
negotiation
분들은 저희가
leverage.
뭔가 제공해 주기가
And
어려울 수
then we did
있습니다.
not have
그래서
any
오히려
solutions that would
처음에는
fully
이노베이터
satisfy their
또는
requirements
얼리 어답터
right
형태를
away.
가지고 계신
So
그리고 조그만
we first
사이즈의 이제 고객을
started
타겟을 하고
working with
이 고객을 또 많이도
small-sized early
타겟하잖아요. 저희는
adopters
첫
and
6개월 동안은
customers.
아무리 많이
So in the
고객을
first 6
만들어도
months,
만나도 세
we
이상의 유료 고객을 확보하지 말자라고
targeted
했었어요.
maximum
이게
2
책임질 수 없는 거다
independent
말이라고.
imaging
실제로
centers.
저희가 150개 이상의 병원들,
Actually,
이미징
we
센터들을
have
뭐
visited
학회
more than
등등을 통해서 만났었고
150
그중에서
imaging
딱 두
centers,
개의 유료
but
고객을 확보를
we
하고 한 6개월 정도
targeted just
지났습니다.
to 2
그러고 나서 이제 첫
imaging
번째 파트너십을
centers.
갈 때도 이
And
고객들과
then
소통한
when
내용들
we went for
바탕으로 좀
initial
고도화되어 있는
partnership,
메시지들과 이게
we
이
looked at
시장에서
all
못
the
버틴다라는
feedback
이미지
and
뭐 이런 부분들을
messages that
함께
we
저희가
received
전달을
from our
하면서
initial
첫 번째
target
파트너십 의미 있는 파트너십이
customers.
체결이 되게 됐고요.
And then that's
그러고
how we
나서
built
이제 계속해서
a
조금씩
first
확장을 하면서
meaningful
두 번째 뭐
partnership,
MRI
and we
7개 있는
began to
고객은 9개월 차에 MRI 40개
expand
있는 고객은 1년 차에
and then go
그러고
for
나니까 이제
bigger
1년 반 정도가
customers
지나고 나서는
eventually.
사실
So
꽤
1
메이저
year and a half
파트너십들도 체결이
into
되게
this,
되고 그리고 그
we
고객들
began
역시 저희가
signing
충분히
major
세일을 할 수 있게 되는
customers
그런 상황이라고 보시면 될 것 같습니다.
in the US market.
그래서 다음 페이지에는 제가 준비해봤던 게
So
저희가
next, I
미국
would
진출
like to talk
3년도에
about
실제 미국 진출 처음 하면서
our
어떤
first
생각들을 했는지 저희
year's
BD 분들과
scorecard.
같이 고민하면서
Airs
만들었던 내부 자료가
Medical's,
있었어요.
we
그거를
have
그걸 일부
developed an
편집해서 한번
internal
가져와봤어요.
document, and
저희는
I would like to
이제
share some
저희
of
제품의
our
특성상
strategy with
한국
you.
내에서는
Given
사실
the
시장 포텐셜이 너무
characteristics of our
제한이 크다고
product,
느꼈었고
we believed that
그래서
Korean
이 제품을
market
제대로
was
살릴 수
too
있는 시장은
small.
여기
So
보시는
we
것처럼
wanted to
젊은이
go
유나이티드
for
스테이츠 정도가
bigger
일단 거의
markets like
가장 스윗스팟에
Germany
있는
and the
곳으로
United
국가라고
States.
생각을 해서
These were the
타겟을 했습니다.
sweet spot
미국에
customers
있는 고객을
for
타겟을
us.
할 때는 또
In
미국에 있는
the
고객들이
American
사실 엄청
market,
다양해요.
of course,
뭐
there's a
병원 시스템도
variety
한국이랑 너무
of
달라서
customer
한국에
groups. They
있는
have an
시스템을
entirely
생각하고서 뭐
different
디스트리뷰터나
healthcare
다른 파트너들을
system.
만나거나 고객을 만나면
So when
전혀
you
다른
talk
세상의
to
이야기를 하게
American
됩니다. 그래서 직접
distributors, they are
만나보는 게 너무
totally on a
중요해요.
different page.
그래서
So it's really
미국의
important to
저희
talk
지금은
to
이미징
them
센터들의 예를
directly.
들어본다면 이미징
For
센터 중
in the United
상당수가
States, a large
프라이빗
number of
에퀴티가
imaging centers
백하고
are
있거나 오wn하고
backed
있는
by
경우가
private
많고
equity
그럼
funds
거기는
or actually
레디올로지스트가 어떤
owned by
관계냐?
them.
거기서는 뭐
And
운영 계약의 관계도
radiologists,
아닙니다. 그러니까 별도
they
계약 관계로서
sometimes
이미징 센터에서 촬영한
they have
이미지를
a
보내주면
contract
이제
with the
그
imaging
사적인 컨소에
centers,
비례해서
and the
연장해서
centers
거기서
will
페이를 받는
send
구조로 집정이
that
돼 있어요.
image to
그럼
the
그렇게 돼 있는 구조니까 뭐
radiologist, and
사실 병원
radiologist will
오너가 뭐
get paid
레디올로지스트의 발언권을 뒤엎고 모든 걸
image by
결정할 수 있는
image.
구조도 아니고 반면 이제 레디올로지스트가
And
병원의 MRI
radiologists
스루폿에 대해서
sometimes
그렇게 민감하지도 않습니다.
is not
그래서
so
이러한 구조들을
sensitive
사실
to
충분히
the
파악하는 게
throughput of the imaging
엄청
centers.
중요하거든요.
So
고객에 비해서
having
고객 자체도
insight
완전히
into this
달라지셔야
kind of
되는데
structure is really
그러려면 이제 타겟을
important
엄청 좁혀야
because
됩니다. 그래서
customers'
저희는
needs are
뭐
totally different
인페이션트,
in the
아웃페이션트,
US
아카데믹
market. So we looked at inpatient, outpatient, academic hospitals. We've done so much research. And everybody asked us, are you working with large customers like MDHD? But instead of targeting them directly, we wanted to go for smaller customers who would really cherish our products. And then we would talk to them directly. And then we would talk to the radiologists, technicians, owners of the imaging centers. And as for our pricing strategy, I thought that they would be willing to pay 10 to 20% of the profits they generate by using Swift MR for our subscription, but we really had to validate if that was the case. And regulatory clearance, this was a totally separate track of process. In order to meet the timeline requirement, we had to find the critical path to get the licensing. Sales and marketing, without sales and marketing and without having the products that American customers want, well, if this product is not widely used in the US market, and people would want to know whether this is really clinically helpful, to go through the trouble of going through the CPT and reimbursement. You have to see whether the physicians are actually willing to go through that trouble. We participated in various academic meetings and met with partners, and I think this was the most effective approach. And we have continuously fine-tuned our products. We have done multiple optimization process. And as for our partners, we looked for partners that can create the maximum level of synergy. We have actually tapped more than 1,000 partners, but one or two actually are found out to be the best fit with our company. So that's how we have conducted our business in the US. And some of our hypotheses proved to be right, some of them wrong. And if there is a right hypothesis, we did in-depth analysis on how they're right. And if they're wrong, we looked at why they were wrong, and then objective set of information. When you're entering the overseas market, I think it's effective to go for low-hanging fruits. But in order to identify them or approach them, you have to find people who would be your hands and feet in the local market. And we worked with an expert who had 3 to 7 years experience in the local market, and we worked with that person for sales. And then that's how we met our first and second customers, which took 6 months. And with that partner and our company have grown together. And as our products got better and better, we began to create bigger opportunities for us. And we were able to recruit more people and have better legal preparedness. The most important thing is to make sure your product is what your customers want. And in order to do that, you need to have a good partner. And I will be open to receiving questions from now on. In the PCT application stage, when should we start preparing for the US IP filing? And what is the approximate cost for filing one key patent? Well, patent filing is actually very interesting, and patent can be seen as your asset or property.
그 특허 때문에 사실 사업 전개가 해당 국가에서
And
어려울까 우려되는 경우가 있을 것 같아요.
sometimes if
그
there is any difficulties
일단
in a
그냥
local market
N수를
for
쌓기만
filing
특허라면
the
당연히
patent,
TPS나 미국 IP 출원은 전혀 생각하실 필요가 없을 것 같고요. 해외로 나간다라고 했을 때
when
해당
you're going
국가에서 실제로 이게 문제
overseas,
특허가 될 수 있는지, 그리고 우리께
you have
핵심
to
특허가 돼서
see
다른 경쟁사한테
whether
진입을
your
막을 수
patent
있는지
can be a core patent,
분석은
blocking the competitors from
그
entering the
국가에서
market.
사업을
And
전개하는 게
in order to
확실시
do
되는
that
시점이라고 저는
analysis,
보여집니다. 그러니까
you
저희들
have to
시점에는
really be
미국은
sure that
반드시
you're going to
들어가야만
do
회사가
business in the
생존한다였기
local
때문에
market.
딱
For
저희가
us, the
진출을
US market
하면서부터
was a
PC
must. It
출원은 바로
was
같이
not an
준비를
option.
했었고요.
So when
미국
we entered the
출원은
US market, we did the
미국
US
출원을
IP filing right
준비했던
away.
그것보다도 사실 좀 많이
And
늦었던 것 같습니다. 그러니까
when we
이거는
prepared
저희가
for US
오히려
IP filing,
저희가 핵심 특허를 보호하는 차원보다 문제 특허가 될 수 있는
it
것들을 탐색하고 나서
we first
그것에
investigated
대한
if
방어
there is any
차원에서 저희 특허를
problematic
출원하는 게 되게
patent,
필요하다라는 생각들을
and
실제로 했었고요.
I filed
그
IP as a defense
네네,
strategy.
그렇게 그 시점에서 저희는 준비를 했었고요. 다 조금씩은 다를 것 같습니다. 그래서
And it
미국
could be
IP
different from case by case.
꼭 보호를 하고 싶은 특허가 있으시면 사실
If there's a
추천
patent
단계에
that you would
이어서
like to
만료가 되기 전에
protect,
미국 IP 출원까지는
you have
진행하시는 걸 저는
to
추천을 드리고, 근데 이제
go for
미국 외의
US
국가는
IP
사실 잘
filing
모르겠습니다.
before
그래서
your
특허로서
PCT
가장
is
유효한 효과를 볼 수 있는 게
expired.
미국 진출하고자 하는 타겟이 미국이라면 사실
And if
저는 한국
you have
특허보다
to
미국
go
특허를
into the
우선할 거라고
US
생각을
patent,
하고요.
I think the
핵심
US
특허 한 건처럼
patent should
저희가
be
PCT나 사격장도
prioritized
좋았던 것
over
같고,
Korean patent.
미국에서도
In the
적용
US
사례로
market,
보여주면은 사실
if
관람료
you're
등등은 뭐 싸구려 아니래요.
classified
설마
as a
원이 들지
small
않아요.
country,
근데
it is
문제
less than
특허의
4
경우에 특허
million won.
분석하고
For,
제대로
but for
쓰고
problematic
하려면
patent, you
사실
have to
못해도
do
1,000만 원
the
이상 들어갈 비용을
investigation. At
생각하셔야
least
됩니다.
it's
저희도
going
뭐
to cost you
2천만 원
10 million
내외까지도
won.
생각을 했던 것
And we
같고요.
even
당연히 이제
consider
진입장애
spending
개수가
up
몇 개
to
넘어가면
20
어떤
million
지역
won.
시향의 개수가
But
얼마
of course,
넘어가면
this
그렇고 같은 경우도
is
있어서 그런 부분들은
variable
고려하셔서
according
예산을
to the
잡으셔야 될
number
것
of
같습니다.
independent claims and other
해외
total
진출 노하우에
claims.
대해 궁금합니다.
As for the
해외
know-how
진출
for entering the
노하우는 그
US
앞서
market
계속 저희가 말씀드린
or
주제에
overseas
되게
expansion,
부합하는 부분인 것 같은데요. 뭐
well,
한국에서 있는
in
헬스케어 기업이 미국으로
if a
진출을 한다라고
Korean
했을 때
healthcare company is
저는
to
미국 내
enter the US
실제로 타겟
market,
고객을 충분히 좁혀 보시고
you have to
그 타겟
narrow
고객이
down
실제로
the
이 제품에
target
반응하는지
customers in the
보시는 거를
United
직접
States,
또는
and
출발이 될
you
사람을
have to
찾아서 그분들과
actually
아주 가깝게
verify that your
일하면서 해야지
target
좋을까라는
customers would
게
want to
가장 중요한 생각이고요.
use your product.
그리고
You have to
처음부터
do it
너무 큰
yourself or work
욕심
with
내는
close
거는
partner. You shouldn't be
생각보다
too
되게 안 좋을
ambitious
수
at
있다라고
first. That could
생각했습니다.
prove
그러니까
to be
성공률이 떨어지는 것도
a very
있고요.
bad strategy
확실률이
because the
워낙
success
떨어져서 사실 프라이싱 차원에서도
possibility is
방어가
very
굉장히
low,
어려워질 수 있습니다.
and it could
그래서
make you
오히려 작은
create
기관들과
difficulties
뭐
for
얼리 어답션에
pricing.
대한 프로모션 등등을 통해서 할인을
Through-
제공하면서 초기 가격
You
세팅을
could
해나가고 초기 가격에 대한
initially
꽤나 대단한
fine
하방에
tune
자신감이
your
생겼을 때, 또
pricing
BM에
at
대한
first.
자신감이 생겼을
And
때
once you're
조금씩 더
confident
큰 기관을
about your
세팅하면
BM,
또 큰
then you
기관은 또 그
can
큰 기관에
begin to
맞춰서 서로
tap
다른
into
요구사항들과
bigger
스테이크홀더들이 들어와요.
customers,
그럼 그
and they will
스테이크홀더들과
have
같이 대응해야
different
되는
set of
부담 학습을 할 수
stakeholders.
있고,
You
그게
will
이제
learn
도중에
how to
학습이
deal
되고
with
나면 그 다음
these
더 큰 기관으로
stakeholders. After
이제
you
이동을
learn
해나갈
that,
수
you
있는
can go and
거라고
tap
생각을
into
합니다.
bigger
물론 이제
customers.
뭐 아예 신약과 같은 접근을 할 수 있는
For
그러니까
new
특정 기술이
innovative
정해져 있는
drugs, of
류들도 있고
course, they have a
사업이라는 있기
success
때문에 제 말이 너무
formula. You're
정답이라고
made for
말씀드리긴 어려울
life,
것 같고요.
but I cannot give you a firm answer right away.
현장 질의 질문 있는지 한번 듣도록
Let's
하겠습니다.
check if there is any real-time question.
해외 진출을 결정하셨을 때 두 분의 경력자와 시작하셨다고
So when
했는데
you
그렇게 좋은 팀을
decided
팀을
to work
들었던
in the
용인이
US,
가장
you said that you have
궁금합니다.
worked with
어떤
two
대표님
people who are
경험하셨던 용인을
experienced in the
사용하셨는지
market. What
궁금합니다.
kind of competency do you think your team should have?
일단 첫 번째로는
And
당연히
What kind of
했어요.
competency did you
저희가
need in your
병원에
partners?
작은
We
병원에
actually
세일즈를
needed
하러
Americans to
다이렉트
work
세일즈하러
with
발로
us.
뛰어야 되는
When
상황이었고
we go to
그리고 이슈가
customers,
발생하면은
visit
언제든 저희 가능한 그
hospitals
서비스를
for
해야 되는
direct
상황이었고
sales, we needed to
그분들이
provide
사실
services
외국인이라서
right
세일즈하는
away
잘안
on the
되잖아요.
ground.
그래서
And
이제
it's better
미국인이어야
to
되는
have
부분이 하나였고
local
실제로 저와
Americans as your
저희와
sales
인접 분야에서
representatives.
다이렉트
And
세일즈 경험이 있는가
we
인접
saw
분야에서
whether they
실제
have direct
소프트웨어
sales
서비스 경험이
experience
있는가 이
in
두
our
가지
field
경험을
of
되게 중요하게
expertise.
봤고요. 그 외에 사실 경험
And
외에
on
소프트
top of that,
스킬 측면에서 되게 중요했던
for
부분이
our
두 분인 게
software
뭐냐면은
competency,
진짜 그 도전 정신 있고
we saw
그
whether
정말
the
이제
person
몰입해서 일할 수
was
있는지를
really
보기 사실
passionate
인터뷰 스크린 되게
about
어려웠던 부분인 것 같습니다.
work
운이
and
좋았다고 보는 게
can
더 맞을 것
really
같은데
deeply dedicate
그걸
themselves
보려는
to our
노력들을 꽤
products.
했었던 것
So we
같습니다.
try to
그래서
see whether that
얼마만큼 열정을
person
가지고
is
나서
really
저
passionate and
일에 참여하고
dedicated about
있는지에 대한
our
부분들을 보려고
business.
했었고요. 그리고 저의 역량이라 함은
And as for my
저의
competency
역량이라 하면
or
글쎄요.
skills as a
이제
CEO,
계속해서 같이 말씀을 나누면서
well, I kept
그 일이
talking
진짜로 되게
to
만들기 위해서 해야 되는 결정들을 하는 것이
our
중요하지 않았을까 싶습니다.
customers and
그래서
partners and made all the
오죽하면 뭐
decisions to
빅어카운트
make
40개짜리
things
딜이 이제
possible.
들어왔는데
Let's
이거
say
지금
we
바로
had
해도
a big
되냐 이런
account
의혹들이 있을 수
hospital.
있잖아요.
Can we
그랬을 때
approach them right
오히려
away?
인내심 갖고
But I
일단
decided
한국에
to
있는
be
기반
patient,
우리 좀 더 찾아보자. 여기
take a
워크인하러
beat,
가보자.
and look for smaller
실제로 콜드콜
hospitals
같이
first
돌려보자. 이런
and go through
디시전들을
cold
하고 같이
call
행동을 하고
together. I made the
그렇게 해서
decision
결국 첫
in time
번째 고객이
and
흥미를
acted
보이고
on it. And when
그
our
고객이 또
initial
이러저러
customers
얘기해서 뭔가
showed
결정해야 되는 게
interest,
많았어요. 프라이싱을
and there
어떻게
were
하냐, 어디
multiple
프로모션을 어떻게 하냐,
decisions
이걸
like
검토는 봤냐,
pricing,
여기
early
예산을 얼마만큼 들어갔냐,
promotion,
계약서는
how
한국에 있는
much
그대로
budget
쓰면
we are
되냐,
willing
미국
to
계약서 쓰면 되냐.
spend. Can we write the
저는 어떤
contract right away?
사스 계약서를 참고를 해가지고 표준
What kind
계약서를
of
잡는 게
SaaS
좋냐,
contract should
뭐
we
IT
refer
시큐리티
to?
측면에서 요구사항 우리가 어디까지
What
갈 수
are
있냐,
the
이런 좀 무시해도
requirements for
되는
IT
리스크냐, 무시해도
security?
되는
Can
리스크는
we
그냥 그 일단 고를
should
해보느냐.
we
그런
comply with
결정도
it
사실 안
or should
했으면
we just
앞에서 아무것도 못해요.
dismiss it? You have to make
그래서
that
같이 얘기를
decision
하면서
right away
잘 모르더라도
for
할 수
you,
있는 결정을
for our
해
team to
주시고 또는
continue to
잘
move
모르는 게
ahead.
아니라 진짜 잘할 수 있는 사람과
So
같이 하는 것도 매우 중요한 것 같습니다.
working with the
그래서 정말 같이
expert who can
잘할 수 있는
provide you
사람을
with the
옆에 두시고
knowledge, it's important to
그분께서
have
정말
somebody who can
즐겁게
assist
하실
you
수
along the
있도록 돕는
way,
역할
who really
그런 게
knows the
이제
market
가장 중요한 것
and
같지 않을까
support
싶습니다.
them so that they can do their job
네, 다른
with
질문 있으실까요?
passion and joy. Is there any other question?
네, 개별 유저 발굴에 대해서는 제가
And
잠깐
for
그
identifying early
발표
users
슬라이드
or
위에서 설명을
individual
드렸었는데
users, I've briefly talked about this in my
저희는
presentation.
타겟한 학회들이 있었어요.
Of
그러니까
course, there were some
실제로
academic
영상학회에서
associations like
저희가
Radiology
잠재 고객이라고 제가 그
Association
가설에 있었던 IT
that we
인디펜던트 이미징
targeted,
센터들의
and
레디올로지스트
independent
또는 오너들이
imaging
제일 많이 다니는
centers
학회가
or
어디야? 이렇게 대조사들을 많이
radiologists.
했고
What
어느
are
정도
the
데이터를
academic
근거로 그분들이
associations
많이
that they
다닌다라는 학회들을 다 찾아다녔던 것 같습니다.
frequent
그래서
to?
당시에
And
거진 한 40개 정도 학회를 참석을 했었고
we have
그리고
participated
거기서
in almost
150여 개
40
정도의
academic
이제 어디언
associations,
유저를
and
찾을 수
then we met
있었습니다. 당연히 이제 규모 조금 있는
150 early
파트너들도 당시에도
adopter
얘기가 많이
users.
됐었는데 일단 규모 있는 파트너들께는 우리가 조금 더 마켓
And as for
스터디를 하고
larger
밸리데이션
partners,
하고
we
이제 도핑하
told them we will
도핑하겠다.
get
준비가
to
되면
them
얘기하자라고 얘기를
once we are
했었고
ready.
다들 잘 기다려 주십니다.
And they were willing to
어,
wait for us.
네. 그렇게 해서 이제 초기 유저들을 발굴을
That's how
했고
we
그리고 그
identified the
유저들
early
중에서 사실
users,
대부분
and
드랍이었고요. 뭐 그
most of
외에
them
또 다른
dropped.
형태로 발굴된 유저는
Most
전부
of them were
워크인이었습니다.
dropped.
그냥
But
이미지를
we
걸어
also
다녔어요.
had
걸어가서
walk-in
찾아보고 콜드콜
customers. We
해보고 그냥
did cold
연락처만 찾아보면
calls
전화해보고
and
그렇게
called on
해서 발굴된 고객이
numerous
각각 하나씩 있었던 것
imaging
같습니다.
centers.
네,
Okay,
감사합니다.
thank you very much. Let me wrap up
마치도록
now.
하겠습니다.
안녕하세요.
Good morning.
안녕하십니까. 저는
Hello, everyone. I'm
시카고에 소재하고 있는
Yong-ha
MBHB
Kim
상점의
from
김용하 변호사라고 합니다.
MBHB in
오늘
Chicago.
발표는 제가 먼저 진행을
I'm
하고
attorney at law,
그다음에
so I
저희
will first start the
로펌의
presentation,
생명공학과
followed by
그
Dr.
대학교
Donald L.
담당하고
Zun,
계시는
who is an expert
도널드
in
전
bioscience and
전
healthcare
변호사님께서
industry.
나머지 담당해 주시겠습니다. 우선
First of all,
미국 지식재산권
I
개요에
will talk
대해서
about the
설명을
overview
드리겠는데요.
of the
일단
IP in the
오늘
United
또
States.
앞에서 들으셨겠지만은
As you have
미국은
heard from other
미국에서 왜
presenters,
지식재산권이 중요한가에 대해서 다시 한번
let me
말씀드리자면은
remind you why
미국은
the
최대
IPR is
시장입니다. 그리고
important in the
경쟁이
United
굉장히
States. The
치열하고
US
시장이
is the
굉장히 커요.
largest healthcare market,
당연히 전 세계
and
모든 기업들이
IP
미국 시장에 진출을
is
하고
a
싶어
key
하기
market
때문에
entry and
당연히
growth
경쟁이 치열하고요.
strategy, and all the companies
아시다시피
would want to
미국에서는 소송이
compete
굉장히
in
작기
the
때문에
American market.
이에 대해서 미리 준비할 필요가 있습니다.
And you
그리고
need to be
지식재산은
able to
시장을
protect
진입하고
yourself because
성장하는
there
데
is a
핵심이
lot of
됩니다.
lawsuits in the United States.
기술을
IP
아무
rights
준비
could
없이 미국
be
시장에
your
진출했다가
key
기술이 뺏기기도 하고요.
strategy.
그다음에 투자
Sometimes, if you're
유치나
not
파트너 확보,
fully
경쟁사
prepared, you could lose
억제
your
전략
technology,
등에 활용을 할
or
수 있고요.
it could be exploited by your
지식재산권이 보호하는
competitor.
대상은
And
혁신 브랜드 투자라고 볼 수 있겠습니다.
the IP
그래서
protects innovation,
특히
brand, and
열심히
investment.
그동안 개발해서 미국 시장에
If you have spent
진출하려고
a lot of
했는데 이
time and
기술들을
efforts to
뺏기면 안
develop
되니까
a technology,
미리미리
you don't want
준비해서
that to be
항상 특허도
taken
확보해
away
두시고
from you.
제가
So you
나중에
have to have
말씀드리겠지만
the
상표나 저작권
patents,
등도 다 고려를 해서 여러
copyrights,
가지 준비를 하시면
trademarks.
좋겠습니다.
They should be all tied
일단
tied up tightly
제가
before
특허청
entering
자료를
the
가지고
US
왔는데요.
market.
그 기업 규모별로 국내 기업과 외국
Let me
기업
talk
간
about
미국에서 특허 소송 접수한
the
현황을 보면은
current
대기업의 경우가 사실
status of
아직은 굉장히
IP
많긴
lawsuits in the
한데요.
United States
비율적으로
by
보면은
the
중소기업
size of the
점점 늘어나고 있는 걸
companies.
보실 수
And of
있습니다.
course,
그래서
they
거의
are
30% 가량이
relevant to
지금
large
중소기업
companies,
승소
but
혹은
about
제소 사례들이
30% of
있고요.
those lawsuits are
제가 예전에
related to
이제
smaller
지식재산보호원이라는
companies.
특허청
I
산하기관과
used to
그다음에
work
또
in
코트라에서 근무를
a
했었는데 그때 보면은
patent office and
중소기업이
COTRA
취소되거나
related
제소당하고
organizations,
제소하는 사례가
and
굉장히 많이 늘어나고 있는
an
것을
increasing
체감을 했습니다.
number of SMEs are filing
특히 이제
lawsuits
분야별로 보면은
or
아무래도
being
한국의
sued.
전문 분야인 전기 전자 쪽에 제소하는
And as
경우가
for the
많고요.
industries,
아직까지 화학 바이오
electric and
쪽이 많지는 않은데
electronics is
계속
accounts for the
추세를
largest
보시면은 많이 늘어나고
portion,
있는 걸 보실
but
수 있습니다. 그래서
healthcare
아무래도
chemical is
한국의
also
기업들이 많이
increasing in
미국에
number.
진출할수록 또
And as more
고도의 기술을 가지게
companies
될수록
enter
점점
the
이런 사례들이 많이
US
늘어날 거기
market, and
때문에
as their
미리 준비하는
technology
것이
becomes more
중요하다고
advanced, you
생각합니다.
will face
그래서
more
지금 이제 왼쪽은 미국
litigations or
전체에서의
lawsuits.
소송
So
분야를
this
탑
looks at
10을
the entire
나열한
US top
거고요.
10
오른쪽은
areas
기업에
for
관련된
litigation, and the right
기술
hands
분야를
are
나열한 건데요.
lawsuits
왼쪽에
related to
보면은
Korean
전기전자,
technology. On the
그다음에
left
이제
hand, there's
그 화학 바이오
electronic,
상당히
electric,
높은
chemical, bio. They
그
account
소송이
for
많은
a
기업
lion's
분야죠.
share of
4등이거든요.
the
그런데 이제
industries.
오른쪽에 보면은
But on
아직까지
the right hand
한국
chart,
기업들이
you can
화학
see that
바이오
Korean
쪽으로 많이 진출을
companies
안 하거나
have
아니면은
not,
이제
they are not so
어떤
prominent
미국
in chemical and
기업과
bio
직접 소송이
industry
될
in the
정도면
United
사실은
States
이게
yet.
엄청 크게
Because
분쟁이 된 거잖아요. 그래서
if you
거기까지
are
빨리
having a
아는 경우가
direct
많아서
lawsuit in the United
아직은
States,
없는데
it's a
앞으로는 이제 아무래도
huge
화학
blown
바이오
up
쪽에 많이
dispute. So that's
그
still
진출하거나
limited in
또 우리
number
기업이
because
좋은
not
기술을
many
많이
Korean
가지게 되는
healthcare
소송이 많이
or
일어날
chemical
걸로
companies are
예상하고
in the
있습니다.
US market, but that could
일단 미국
definitely
지식재산권의
change
종류를
down the road.
간단하게만
So let me
살펴보면은 사실 이런
briefly talk
내용들은 다
about the
교과서에 있기 때문에
characteristics
제가
or
정말
the
간단하게만
types of
말씀드리고 저희
IPR in the
이제
United States.
실무적으로
I'll be
어떤 것들이
very
문제가
brief
있는지 거기에 초점을
and
좀 맞추도록 하겠습니다.
talk
일단
about the real issues.
특허는
As for
어떤
utility patent,
기능적인 것을 발명했을 때 내는
it
것이고요.
protects the novel
그러니까
and
예를 들면
practical
프로세스나
functions of an
제조물,
inventions like
기계,
processes,
특히 이제
manufactures,
헬스케어 같은 경우에는
machines,
의료기기를
especially
많이
medical devices in the
특허를 내시겠죠.
case of healthcare
그리고 이
industry,
특허가 만료되기
and
전까지 타인이 특허받은 발명을 만들거나
grants
이용하거나
exclusive
판매하는
rights to
것을 금지할
prevent
수 있는
others from
독점권을
making,
가지고
using,
있습니다.
or selling the
그리고
patented
미국 같은
invention
경우에는
until the
디자인의
patent
경우도
expires. In
디자인
the US,
특허라는 용어를
design
쓰거든요. 그래서
patents
특허의 일종인데
also exist.
이
It's a type
장식적인
of
외관에
patent.
대해서 보호를
It
하고요.
provides
그래서
protection only
예를
for the
들면은 내가 어떤
ornamental
기계를
appearance of
발명했는데 이게
manufactured goods. Let's
특허는
say
그
you had
안에 있는 기능을
developed a
얘기하는 거지만
machine
예를 들면 내가
and
외관도 되게
appearance. And if the appearance is exceptional or highly attractive, you might also want to apply for design patent, which is much cheaper to get. And as for trademarks and service marks, it is a distinctive word, symbol, or combination of words or symbols that identifies the source of goods and services. Notable case could be Coca-Cola, because you can see it from a distance and still know this is Coca-Cola. So that kind of trademarks would be highly valuable, like Facebook's Meta. They have spent more than $60 billion to buy that trademark, because trademarks could be highly valuable. And other types of IPR could be copyrights, software codes, or product description, music, drawings, videos, marketings. This kind of creative work could be subject to copyrights. So, but if you are heavy on software, it is better to go for copyrights rather than patents. Copyrights, as I've mentioned, could include variety of creative works like product description and music and pictures. And this would legally protect the uniqueness of your creative work. And as for trade secrets, it's broadly defined as a confidential information that has commercial value and is kept a secret by a company through efforts to maintain confidentiality. It could be a list, various things like a list of your customers. That kind of information should be protected as a secret to be valuable. So there could be not publicly disclosed and not generally known, and should be not easily obtainable by third parties, and it should have economic value, should have actual or potential independent economic value. And for security and secrecy, it requires reasonable efforts under the circumstances to maintain secrecy, like a small number of employees have access to that information, or there should be a lock around the information. So these are the characteristics that must be met to qualify as trade secret. It includes technical information or business information. And as for the duration of IPR, for utility patents, it's 20 years from the filing date, design patent, 15 years from the date of registration. And trademark is almost perpetual, as long as the mark is used in connection with the goods and services and registration. And it could be potentially perpetual. In the case of copyright, if it is not work made for hire, it's 70 years after the author's death. If the work made is for companies, it's 95 years from date of creation or 95 years from the date of first publication, whichever expires first. As for trade secret, potentially perpetual as long as legal requirements for trade secret protection are met. This is the end of my part, and I would like to give the microphone to Ms. Dr. Zun.
Avery, I think you're going to control the slides. Hopefully that's still possible. Thank you for the invitation. Good morning. I've been asked to talk a little bit about the patent process, U.S. patent process. A lot of similarities between the way things are in the U.S. and the way they are in many other countries in the globe, including South Korea. So there are some real key points that you want to take home so that you don't have a result of a loss of patent rights. We generally start the patent process with an invention disclosure, which could be as small as an abstract or a little bit more thorough, like a clinical trial protocol or a manuscript that's going to be published, PowerPoint. And then we take this, in some instances, we would do a prior art search. I'll talk a little bit more about that in a few minutes. And then prepare a provisional application. Provisional applications, by the way, are things that are fairly unique to the US. India also has them, but it's kind of a placeholder. We file this. They're not examined by the USPTO, US Patent and Trademark Office. And instead, they just kind of like reserve your spot in line, your spot in the queue. And so when we file the provisional application, this starts a clock, and it's very important to do certain things after you start that clock. Otherwise, you're going to have a potential loss of patent rights. And so 12 months after the filing, it could be shorter, but it can't be longer. We have to convert that provisional application to a PCT application. In some instances, we also file a US non-provisional application. The difference between the US non-provisional and the provisional is that the US non-provisional is examined by examiners at the USPTO. A PCT application, it's like a clearinghouse. WIPO, the World Intellectual Property Organization, administers it. There are many countries that are signatories to the PCT, Paris Convention Treaty, including South Korea and the US. There are a couple countries that are not for various reasons, and I've got a couple examples there: Argentina, Pakistan, and Taiwan. And so at the same time we would file a PCT and or a US non-provisional. You don't have to file a US non-provisional, by the way. You can file a US application off the PCT later in time. We have to file in non-WIPO countries if you want to get protection in those countries. And so every country where you want to get protection, you have to file a national application to have it examined in that country. 6 months after that, the application is going to be published, whether it's a PCT and or US non-provisional. And then 12 months after publication, we have a 30-month deadline where we have to enter that PCT application into national and or regional stage. Regional stage would be before the EPO, the European Patent Office. But you could also file that PCT, and I listed a couple offices here. These are the 5 biggest patent offices on the planet: the USPTO, the Chinese Patent Office, European, Japan, and then South Korea's own patent office as well. And so now we're going to go through a examination process in front of examiners, exchanging responses and getting office actions from the various patent offices. And hopefully we line up with a patent being granted. So you might be wondering, what is a patent application going to look like? Generally, it looks a little bit like a manuscript, although it has one section that is very distinct and unique to it, which is Section B, the claims. So we have a specification which would have examples and materials and methods and definitions and so forth. And then claims, which define the property right or the scope of protection that the patent is going to provide. It's like a deed for real property. And there's a famous quote from one of the longest serving federal patent judges in the country, Giles Rich, which the name of the game is the claim. And that is absolutely the truth. And then also we have drawings which are semi-optional. In some cases, they have to be added on our side of the fence. And by our side, I mean biotech and pharma. They are more optional than necessary, but you would put them in to help describe the claimed invention. Next slide. So when we're writing the patent application, we have to think about who the relevant audience is. And it's not just a patent examiner who's going to be looking at it. It's also the inventors who have to, sign off on the content of the application. And in fact, in the US, they have to sign declarations that they've read the application, that it is correct. We have, and this is a skill of art, a term of art, a skilled artisan or a person of ordinary skill in the art. This is a hypothetical construct of a person who understands everything in that various area or the various subject matter of the application. The patent attorney or patent agent, we have patent searches. Then importantly, if it's going to ever be asserted for infringement, you're thinking about the judges and the jurors. And then maybe even most important, your competitors and their patent attorneys, that's part of the relevant audience as well. So what's required to get a patent? I like to split the requirements into two categories: requirements for patentability and then the requirements of the specification. And the reason I've split these into two is because as a patent attorney, the first batch of requirements, those are things that the inventor or the applicant bring to me. They have to be inherent. I can't really add them. The second batch are the requirements that your patent agent or patent attorney should be helping make sure that you comply with those. And then also, the requirements are very similar from one country to the next. And so in parentheses, I included the term that we use outside the US. And so utility in the PCT and then in most countries is also referred to as industrial applicability. Non-obviousness is referred to as inventive step, and so forth. The requirements are pretty much the same, although the way that the patent offices look at them might be a little bit different. There may be nuances for each of them, but they're basically the same from one country to the next. Next slide. One of the reasons I am happy that I went into this particular career is my mentor told me when I first started that one of the nice things about patent law, as opposed to maybe wills and estates or real property, land, is that it changes frequently and in big ways. And so you can see all of the requirements that I just spoke about, except for enablement, have had in my career important decisions or important guidelines issued by the USPTO. The Supreme Court issued a number of decisions on patentable subject matter. Maybe that's the most recently touched on requirement. And then Congress, with the American Invents Act that was took effect in 2013, has also changed the way we do things in the US with patent law. Next slide. So for South Korean companies, what should you be thinking about? And I think that the three things that I've listed here that I'm going to talk about, there are important considerations for any company in any country, anywhere in the world who wants to get involved in securing US patents. The first is, and I mentioned on the first slide, we can do a prior art search. We can also do freedom to operate searches. And so if you want to do something in the US, it's important to make sure that you're not going to be infringing other parties' patents. And that's why we do a freedom to operate search. And this will help reduce your patent infringement risk. Also, if you want to get your own patent, a prior art search can be very helpful for two reasons. One, it can reduce your prosecution costs, and it does this by helping us better focus what the claim should look like. And instead of, in some instances, my clients will let the examiner tell us what we can and can't have, but it will save money in the long run and save time as well if you do some prior art searches to figure out, before the examiner tells you what you can and can't have, what you're likely to be able to get allowable claims on and get a patent for. One thing that is very important in patent practice is to make sure that you don't disclose important aspects of your claimed invention. In fact, I like to tell my clients, don't disclose anything. publicly until the application is on file. And so when you get that provisional application on file and you reserve your spot in the queue, then you can talk to funders, talk to collaborators, talk to other members of the public about what you've got on file because you've got your spot reserved in line. And I can't tell you how many times in the 2.5 decades I've been doing this where companies make the mistake of publicly disclosing inadvertently, not intentionally, their claimed invention before we've got it protected. And that public disclosure can be really damaging. In the US, we have a grace period where for certain types of activities, you can, a month before you file, inadvertently disclose the invention. And there are grace periods in South Korea as well, but in some jurisdictions, Europe, which is a very important jurisdiction, there is absolute novelty. And so any disclosure at all is very damaging to your patent rights. So it's very important to line up your patent attorney and get an application on file before you make any kind of public disclosure. For biopharm companies that are doing clinical trials, that's very difficult to do because your regulatory agency, the FDA in the US, for example, is looking at things differently than USPTO is, and they have a different timeline than the USPTO. And so sometimes you have to put together a clinical trial, and you have to publish that on clinicaltrials.gov, and that can create some issues. So it's best at an early stage to loop in either your internal patent counsel or find good outside counsel in whatever country you're looking to pursue rights, and make sure that you're not doing something that's going to result in a loss of rights. The last point I have in this slide is about foreign filing licenses. And this is also a very important thing to be concerned about, especially if you're in a collaboration. Many countries have a foreign filing license requirement. The US is not an exception. It has one. South Korea has a little more limited foreign filing license requirement. India and China are examples that have very stringent ones, just like the US. And so if you're in a collaboration with a US company, for example, you would have competing rights. If you have inventors who are Korean and inventors who are in the US, and the invention has been made collaboratively in both countries, you have to work that through. There are ways to address the problem so you can figure out what country to file in first. But again, it's really important to line up good patent counsel who will help you prevent making a grave mistake and resulting in a loss of patent rights. In the US, if you don't get a foreign filing license and you file in a different country, you could result in rendering any US patent you get being unenforceable. And that would be really terrible, that you are prevented from being able to enforce your patent for kind of a technicality. Next slide. So I just wanted to mention a few things about MBHB. We're a full-service IP firm handling all the different types of IP that Avery just talked about in her slides. And we're headquartered in Chicago. We're almost 30 years old. We have a mix of attorneys and patent agents. US patent law is a little bit unique in that you don't have to actually hire a patent attorney to interact with the patent office. Patent agents are one of two categories of non-attorneys in the US who can actually act kind of like attorneys. There are some things that patent agents can't do that you need to have an attorney for. So, for example, prosecuting a trademark application has to be an attorney action. But for patent engagement with the USPTO, patent agents can do almost everything. Almost all of our practitioners are licensed, registered with the USPTO. and many hold advanced degrees, including a number who have PhDs. Next slide. Of the patent attorneys and agents that we have, 26 of them are in the biotech, pharma, chemical, what I like to say life sciences area. Also, I throw medical devices in there, and for that, we can interact with engineers. We have a lot of engineers, mechanical, electrical, software engineers. Also, one thing that we're seeing a lot of now is AI and comp sci being integrated in the biopractice. And so when I have clients who are looking for that kind of patent application, I generally work with a number of comp sci attorneys and agents that work at my firm as well. So you can see the split up of attorneys. Here's a list of all the folks in the biotech and pharma practice group. You can see we got a lot of advanced degrees in the group. You can go to the next slide, Avery. That was fine. So here's what our practice group works on: biotech, chem, farm, diagnostics, medical devices. We have a wide variety of companies. Some are in the Fortune 100. There's also just individual inventors that I work with, new startups that I work with, and we do a lot of work for academic institutions all around the globe. Here's a list of some of the stuff that we work on. That's pretty self-explanatory, so I think we can go to the next slide, which is a list of more the types of subject matter that we work on. It's not an exhaustive list. There are some things I mentioned, comp sci type related things that we work on, that and AI is becoming a big part of what many of our clients do as well. And to be honest with you, I know a lot about the subject matter that's on this list right here, but when it comes to AI, I'll consult with our comp sci attorneys on that, just to give our clients the best representation possible. Next slide. Here's a list of some of the awards and accolades that we've received over the years, and that's pretty self-explanatory as well. And I think the last slide is, I don't usually give a presentation without mentioning that we have the Patent Docs weblog that I started with Kevin Noonan, one of my partners, back in 2006. And so we've been doing that since then. It started out as a biotech weblog, but now we've got a number of engineers that write about issues that are a little bit more related to what they do. Although one nice thing about patent law is that patentable subject matter, for example, is, I like to say that it's a bridge that unites both practice groups, the high tech and the life sciences practice group, because we're both seeing similar issues and we can learn stuff from each other, and what we're finding out in the case law with courts rendering decisions, including the Supreme Court, that have had huge impact on patent practice in the U.S. over the last couple of years. And I think that was my last slide. The last one is just contact information for Avery and myself.
Thank you so much, Don.
네, 던
welcome.
변호사님
Thank you. Thank you for the
감사드립니다. 네.
이제 빠르게 좀 저희
Now
디지털
we would
실험할
like
때
to
유의할
step
점에
on the
대해서
gas
좀
and
말씀드리고
talk
싶은데요.
about the things that we need to be
일단
cautious about
여기서
in
다 설명드리기
filing.
조금 시간이 없어서
I
몇
won't be
가지만
able to
좀
go over
추려서
everything, so I would like to
말씀드리겠습니다.
focus on
한국에
the
이미
key
실험을 한
points.
경우에는
If you already
한국이
have
태어난 날로부터
applied
1년
in
내에
Korea,
반드시 실험을
you
해야
have
되거든요.
to apply
그래서
within 1 year from
사실은
the
엄밀히
filing
말하면
date in Korea,
발명이 공개된
meaning that
시점부터 12월 안에
once
실험을 해야
the
되는데 한국이 실험된
invention is
경우에는 한국이 시작된
disclosed,
날짜가
you
반드시
have
공개된
to
날이기 때문에
file within 12 months. So US application must be filed within 12 months of filing in Korea. So it's better to file for the US application as soon as possible if you have already filed in Korea. So if that is an important point to remember. And as our attorney, as the previous speaker has mentioned, if first filed in Korea, entry into the US is possible within 30 months via PCT, and the US patent system is strict with software patents, so special care is needed when drafting claims. And as Dr. Dawn Zoon has mentioned, before market entry, it is essential to conduct a patent infringement analysis called freedom to operate to confirm the risk of infringing competitors' patents. So it's very helpful to go through FTO analysis. And then, as for the patentability, you have to assess systematically from the early research stage and scope of patent protection. If it's too narrow, others can easily design around this. If it is too broad, there's a risk the patent may be invalidated. So you have to find the right balance in scope of patent protection. And as for ease of detecting infringement, it's actually very critical. If infringement is difficult to detect, then patent value will decrease. So we need to be mindful of ease of detecting infringement. And competitors, of course, you have to find out whether there's a competitor. And if there's a competitor, you have to file as soon as possible. And consider filing patents simultaneously together with trademarks or design patents. And the sooner you have the rights, it will remove a lot of difficulties that you will face in the US market. And it takes a lot of money to file in the United States. It could go up to 14 million won in Korean. And bio IPR, because it's complicated, it can go all the way up to $30,000. And patents can create entry barriers for competitors, but disclosure may also allow competitors to exploit your information. So you need to be mindful of this risk as well. And we have talked about provisional application, which is a unique system in the United States. So if you have filed for provisional application, the requirement is far simpler. Let's say you have a presentation material or leaflet, you can submit them to the USPTO. But if you file regular application within 12 months of the provisional, and if you don't do that, the provisional is deemed abandoned or withdrawn. And as for trademarks, of course, we are running out of time, so I will just mention that in the US, you have to actually use the trademark to continue to get protected. So there's actual use requirements in the United States. And of course, application can be based on intent to use, but you shouldn't spend more than 3 years after that. So within 6 months, if you are going to file, then you should apply for the patent. I will skip this. As for copyrights, you have to be mindful of who owns the copyright. It should be mentioned in the contract. When you're signing contract, well, actually, it's relevant for all of IPR. The ownership of IPR should be clearly defined in the contract document.
그 영업 비밀은 아까 말씀드렸던
And as
것들,
for
그
trade
회사 안에서
secrets,
비밀을 유지해야 되는 것들.
it
그래서
should
이제
be
이런 영업
kept
비밀들은
secret
재료
inside the
공정이나 임상 시험
company,
데이터나
such
원가나
as
가격
clinical
전략 등은 특허에
data
공개하는
or
것보다는
pricing
비밀을 유지하는 게 더
strategy.
나은 경우가
It's better
많거든요.
to keep
그래서
them
이럴 때는
secret
영업
instead
비밀이라는 이
of
제도를 활용하는 게 좋겠죠.
disclosing
아무래도 특허로
under
되는
patent.
것보다. 그래서 대신 이 아까
So for
말씀드린
these
것처럼
trade
그런
secrets,
그 조건들이 있었잖아요.
there
뭐
are
반드시
certain
뭐 몇
requirements,
명의
like
직원들만
there should
들어가야
be a
하고
small number
뭐
of
직원
people who
접근
have
최소화하고
access to
보안
this
교육 실시하고
information. There should
파트너들과는
be
반드시 NDA 계약이라고 해서 non-disclosure
security
agreement이라는
training,
계약을 체결하는
and
것도
there
있을
should be
테고요. 이런
NDAs
자세한
with
것들을 혹시
partners.
궁금하시면 저희에게
If you're
질문을 해주시면
curious
제가
about
또
these
자세한
details,
내용들은
you can
이메일로
ask
드리거나
questions
답변을
and I can
드리도록
email
하겠습니다.
you the information.
예, 그래서 저희가 이제 이 발표 자료를 아마 다 공개를 할 거라서요.
And we are going to
한번
be sharing
읽어보시고 이
this
체크리스트에서
PowerPoint
궁금하신
slides,
점
so please
있으시면은 또 추가로
take
연락
a
주시면
read. And
제가
if you have
살펴보고
any
또
questions
그
from
예를
this
들면은
checklist,
실제로 이제 미국에
please
진출하시게
let
되면은
us know when
현지
you're ready
제조
to
생산
enter the
업체도
US
제공을 하실 수
market.
있잖아요. 그러면은
Sometimes
그
you
영업 비밀에
might
대해서 계약상으로
share
다 한번
trade
제대로
secret with your
계약을 당연히
partner
제대로
company in the
맺어야겠죠.
United
아니면은
States. So you have to
잘못되면
find a
이런 일들이
proper
실제로 심상치 않게
contract to
일어나거든요.
protect your
뺏기는
trade
경우, 너무
secrets.
억울한
Sometimes
경우도
your
일어나기
trade
때문에 저희가
secrets
그런 걸
are
많이
leaked
봐와서
in a
꼭
very unfair manner.
계약서는
And so
변호사
it's
통해서
very
검토하시고 미국
important
변호사를
to
통해서 검토를 꼭
have
하셨으면
your
좋겠습니다.
US attorney review your contract.
네, 감사합니다.
Thank
이렇게
you
발표
very much.
마치겠습니다.
That's the end of my presentation.
네, 사전 질문을
So there is
받았는데요.
a question that has been received. Do
한국은
US patents
특허권자
really
수수료를 너무
protect
낮고
technology? In
세계보다
Korea,
한국 앞서서
patent
기술
holders'
보호가 잘
win
안 되는
rate is very
중입니다.
low,
이런
and it
질문이
seems that
있는데요.
competitors often use
그
design
아무래도 이제
arounds.
미국은 소송이
The
워낙
US,
흔하기 때문에
of course,
소송 기간에
lawsuits are
소송의
more
결과가 굉장히
frequent
중요할
and
수 있죠.
prevalent in the US.
아마
The
신문에서
result
많이
of lawsuit
보셨겠지만
could
미국
have a
같은
lot of
경우에는 뭐
significance in the US.
배심원이
Like
이런
the juries,
손해배상액을 산정을 하는데
when
보통은
they
뭐
calculate the
작게는
amount
몇
of
백, 몇 백억,
remuneration,
크게는
it could be
천억까지도 가는 경우가 있거든요.
up all
정말
the way up to
너무
hundreds
놀라울
of
정도의
billions of
가격들이
won.
나오는데
Sometimes the
그러다
amount of
보니까 미국에서는
remuneration is
아무래도
so
이제
stunning.
좀 그 특허권을 침해하는 거에 대한 부담이
So
많죠. 이제
in
소송을
the
당할 수도
United
있고
States, there is
또
a
소송
lot
액,
of risk involved in
그
infringing a
손해배상액이 워낙
patent,
크기 때문에
and the
그리고
remuneration
이제
amount could be
미국 같은 경우에는
skyrocketing.
특허권자의 승소율이 훨씬 높다고 합니다.
In the
그
United
통계에
States,
따르면
patent
한국보다
holders'
그래서
win
3,
rate is much
40%라고
higher
하고요.
than that of
한국은
the
보통 한 20%
in
이하
Korea.
정도를
In
언급이
Korea,
된다고
it's
합니다.
less
그래서
than
특허권을 가지고 있는
20%,
경우에
but in
아무래도
the
미국에서는
US,
좀
it's
효과가 있다고
the win rate
저는
is far
생각을 하고요.
higher than
그리고 이제
that of South Korea.
상대방이 이거를 고의로 침해했을 경우에는
And if
뭐 만약에
the
손해배상액이
infringement
뭐
was
팔았던
intentional,
어떤
the
그
compensation
제품의 가격이나 이런 로열티 같은 거 따져가지고 이제
amount
배상을 만약에
will
10억을
be
책정을 했는데 상대방이 알고 보니까 이거를 막 고의로
much
침해를 했다 하면은
higher.
그걸 3배까지 띄울 수가 있거든요.
It could be
그러면은
triple
그거
the
30억까지도 받을 수
average
있기 때문에
damage.
아무래도 좀 한국
So
시장은 기술 보호에 효과적이라고 할 수 있고
your technology
뭐
is far
미국도
more
사실은
likely to be
기술
protected in the United States.
네 기술 회피 설계를 많이 미국도 실제로 회피 설계를
And
많이
of
하는데요.
course,
그렇다고
competitors
하더라도
in the
이제
US can
아무래도
do design
미국은
arounds,
강력한
but even if
손해배상 제도,
that
그다음에
is the case,
특허권자에게
the
유리한
strong
소송 결과, 또
compensation system in
공정시켜가지고
the US
가져오는
and patent
특허권자에게
holders
유리하다고 하고요.
win
또
rate is 30
배심원들이
or
이걸 판단을
40%,
하잖아요.
and juries
결정을
decide the
하잖아요.
compensation
판결을 하잖아요.
amount.
그런데 배심원들이 보통은
And juries
특허권자의 입장을
are
많이 대변합니다.
usually
그래서 특허권자에게 좀 유리하다고 할 수 있고요.
on the side of
그다음에 이제
patent
뭐 미국 같은
holders.
경우에 연속 출원이라고 해가지고 뭐
And
계속
there is
컨티뉴어스 애플리케이션
consecutive
그래서 그
application or
이렇게
continuous
뭐
application in
이미
the
이미
United States.
이미 특허를 냈는데 거기에
If you
연계해서
already have a
이거를
patent
더
and if you
했어요.
have
이걸
a
더 했어요. 이렇게
follow-up
해서 계속 그
related
특허의
patent,
pending 상태로 놔둘
then
수가 있거든요.
the
그런 것들을
patent
이용할 수
can
있고요.
remain
그래서
pending, so
여러
you can
가지
take
방법으로
advantage of that system.
특허권자에게
So
좀
there are
유리한 제도가
various
마련되어
ways
있다고
to
저는
gain an
생각합니다.
give an upper hand to patent holders.
일단 저희 사전 질문은 요거
So that's
하나를
all
받았고요.
for the
그
previously
따로
received
또 라이브
questions.
채팅이나
If there
이런
is any questions received in
질문
live
추가 질문
chatting
있으시면은
rooms,
제가 받도록 하겠습니다.
I will be open to answering further questions.
저 말고 또 도널드 변호사님께도 직접
So
해주셔도
you can also ask questions directly to Dr. Zhu,
언어로 질문해 주시면은 저희 답변.
either in Korean or English, whichever language is more convenient for you.
네, 추가 질문은 없으신 것 같아서
It
일단은
seems like
종료하도록
there's no
하겠습니다.
further
뭐 추가로
questions, so I would like to wrap up. But if you have any other questions, please contact the Secretariat office and we will love to answer your further questions. Thank you very much for your attention.